So, welcome to the lecture, and we will be discussing the antifungal agents. So, starting from the classification of fungi are divided into two groups. One is the yeast, and other is mold. Yeast, as you know, that yeast are the single cell fungi, and molds are multicellular fungi. Then we come across examples of yeast and molds. As you can see, the yeast, Blastomyces candida, etc. While in molds, Aspergillus species and dermatophytes, while as well as mucor. In clinical classification, these are divided into two: superficial mycosis and deep or systematic mycosis. The term mycosis refers to the infections caused by fungi. So, type of fungal infections to whom we also refer the mycosis. So, first one is the superficial mycosis, as referred by the name or simply known by the name that it is superficial, affect the superficial organs as the skin, hairs or nails, etc. Then comes the subcutaneous mycosis. It affects the muscles and connective tissues immediately below the skin. Then in systematic invasive mycosis, the involvement or the mycosis of the internal organs. Then it also divides into the primary versus opportunistic. So the allergic mycosis affects the lungs or sinuses, and the patient may have the chronic asthma, cystic fibrosis or sinusitis. Now note that the mycosis are the infection caused by the fungi, and these four are the more important classification of the fungi or the division of the fungal mycosis. So superficial, subcutaneous, systematic and allergic mycosis. It's a general summary of the antifungal drugs. We will take a look, but for now, starting from the cell membrane active antifungals. So cell membrane, as you know, that the polyene antibiotics, amphotericin B, lipid formulations and nystatil, these are the cell membrane acting antifungals. So their classification will be that cell membrane antifungals will be divided into two groups. One will be the polyene antibiotics and the other will be the azole antifungals. In polyene, it is amphotericin B, lipid formulations and nystatins, while in azole, it will be ketoconazole, fluconazole, voriconazole, etc. So, what does this cell membrane active antifungal agents mean? It means that when we will use antifungal drugs, these antifungal drugs will act on the cell membrane of the fungi, and due to their action on the cell membrane of the fungi may not survive or may not be able to produce further mycosis. Then the secondly, drugs acting on the DNA and RNA synthesis inhibitors. Synthesis inhibitors simply means that the formation of the DNA and RNA won't occur or happens. So DNA and RNA synthesis, the most two important are the pyrimidine analogs and fructosidine. Then after that we will come across the cell walls. In cell wall, the two main are the capsopungin acetates and the echinocandins.